Yes. Yeah. If you want to hit admit all, that'd be great.
All right, you got it.
Good evening, everyone.
Hello.
Welcome, welcome. Thanks for bearing with us. We had a little bit of a technical difficulty, so we're running just a couple minutes late, but thanks for showing up tonight.
We are excited that you're here. So we should be screen sharing right now. So if you see our first slide on there, it has some information. You can sign up for our tonight's giveaway. So please feel free to scan that QR code, or we'll drop the link in the chat. And by 6 p.m. tonight, we would love it if you guys could sign up for that giveaway. So that way we can put you on the spin the wheel at the end. Guru Nada has a really, really fun grab bag giveaway for tonight's presentation.
Okay, so as you guys are getting settled, we're also going to encourage you to stay engaged throughout our presentation and ask questions, share insights, and participate in the conversation. So the Social 630 will be sending out a Best in Chat prize for the evening. So to keep the interaction going, the winner will receive a black on black Social 630, very similar to this, but
these are our speaker only.
Yeah,
sweatshirts.
Oh,
good, yours came, Joy. I'm so glad yours came.
Okay.
Oh, good.
I got some cookies if you want some of those.
And if we could have everybody silence their microphones, that would be also awesome too. We'll go through and try to keep everybody silenced, but just a friendly reminder to silence or mute yourself. All right. And as people are still joining on here, we can see we will flip through. If you haven't had a chance, please scan that QR code or screenshot that for the link, and then we'll try to drop that in the chat here in just a little bit too. So we're going to go ahead and get moving since we are running a few minutes behind. We're going to try to get things moving along here. So for those of you who it's your first time, my name is Amanda Nash.
I'm Christy Michael,
and we're the co-founders of the Social 630. Also in the chat, be really active, put where you're from in there. We want to hear and get to know you a little bit better. The Social 630 is a dental hygiene focused society. It's built on connection, collaboration, and commitment to elevating patient care. And the Social 630 was born out of a time of isolation and really an opportunity. It gave Christy and I an opportunity to really think how we wanted to reimagine and re-envision our hygiene department. And it kind of came at a time when all of us were feeling isolated, which was during COVID. And it really transformed the way that we practice today. And it gave us an opportunity to collaborate with our colleagues and create this community, which we are just loving to see the growth this year as we are doing webinars and going virtual. And we're able to collaborate and really help our patients get to the bottom of their health, oral health concerns, and find root cause solutions for our patients. So we are glad you are here. That's a little bit about us. If you've been here before, you probably heard a little bit more of our story and background. But due to time, we're going to kind of keep things moving along. We do have, I think we're on what number? Is this 5th event of 11 starting? I don't know. I think it's something like that. I think we're on number 5 of 11. And so we're almost halfway through the year on all the calendars on our calendar and things. Joy, can you tell me what it's looking like on our shared screen? Our computer is kind of freaking out a little bit.
It says enter to win, and it has the QR code.
Okay.
For Guru Nanda bag.
Okay, perfect. And it's the full slide.
it says present, so I can see like your Canva
Oh,
page.
okay. That's where it's froze for us too. And I am trying to see if it will let us go full screen with it, but it's kind of struggling. Okay. There we go. There we go. We got it. Okay.
There it
Thanks for
is.
bearing with us. We've had a slew of technical difficulties tonight, so we're working through those. So we are so excited to welcome our friend Joy here to present to us tonight. And we just want to tell you, share a little bit about you, Joy. And before we get started, she's a dental educator, consultant, and clinician, and she's dedicated to advancing integrative prevention-focused care. She earned her certificate in oral facial myology through the International Association of Oral Facial Myology in 2017 and currently serves as IOM president. In 2022, she became an international board certified lactation consultant, further deepening her whole body approach to oral health. Joy is the founder of Joy Lantz, Transforming Oral Health, where she educates patients, parents, and professionals while consulting with dental practices seeking to thoughtfully integrate airway-centered care. Her passion lies in empowering dental and medical teams to collaborate in early screening for oral, myofunctional, and airway disorders to support lifelong health. Joy has become such a special part of our journey here at the Social 630, and we're so honored to have her with us tonight. Since meeting her at RDH Under One Roof last year, we have been beyond blessed by her wisdom and expertise and friendship that has grown from it. So we are going to turn the time over to you, Joy. And then in the meantime, I'm going to get that link for all of our attendees in the chat so they can enter to win that giveaway. And we will be also just counting and collecting in the chat who's participating the most and asking questions, and try to respond to everybody's questions in the chat as well. So we're doing things a little bit backwards tonight, not in the order that we were hoping to, but even still, be sure to click the link or copy and paste the link from the chat for everybody who's listening if you want to enter that giveaway. So I'm going to I'm going to stop sharing so that way you can screen share, Joy.
Great.
All right. We'll stop our share.
I look good?
Yeah.
Awesome. Yeah. All right. Thank you, ladies, so much for the nice introduction and for having me on. I appreciate it so, so much. And I'm so glad that we got to meet at Evolution, and it's been just an amazing journey from there. It's hard to believe that it was almost a year ago already. So tonight what we're going to talk about is fundamentals of myofunctional therapy. I love the title. You need to calm down and breathe through your nose. So at the end, we are going to go over a little breathing exercise for everybody here just to help you get through your day and realize how important breathing is. And it's one of the things that we really don't we don't think about it. How do we breathe? I know when I ask my patients, they have no idea. So we'll talk about that at the end. All right. So I know you gave me such a beautiful introduction, Amanda. Thank you for reading all that, but just really basic overall generalities about me. I've been an RDH since 1998. So since the 1900s, it's been a really long time. I am a board certified orofacial myologist. I started that in 2016, and I currently have a private practice where I do myofunctional therapy, and I am a lactation consultant. So between myofunctional and my IBCLC work, I keep busy 3 days a week there. And then I also speak a lot, and then I'm a practice consultant for dental practices that want to bring these concepts into their world. So if they want to bring airway, frenectomy, myofunctional therapy, sleep, these kind of concepts in, I help them strategize where it can fit in, how to do screenings, and all of that. So it's really awesome to be able to help other offices bring these concepts in, because it really is so needed. There's not enough of us out there. So that's another reason I'm so glad everyone is here tonight. Give you some little tips. So these are just a few disclosures. I am the owner of my own company for consulting and speaking and educating. I do develop courses and I educate at my website. I also host a study club, and I have my sponsor relationships listed here. And then, of course, I just want to put a quick disclaimer up. So, if you are learning these things, we are not telling you to go back to your office and like do all of these things, but we do recommend that you go get trained if myofunctional therapy is something that interests you. And that being said, there are definitely things that you can be doing chairside with your patients to help them get to a better spot to even be able to do myofunctional therapy. So we're going to talk about that too. These are just a few overview key points of what we're going to talk about tonight. Get an understanding of what orofacial myofunctional disorders even are. Learn a strategy for screening your existing patients for these disorders. I guarantee you probably, in an 8-hour day, at least half of your patients have something going on with these disorders. And then identifying the benefits of intervening and preventing myofunctional disorders and helping patients kind of work through what they are dealing with. So I love that you have the chat very active because I want to hear in the chat what you see on the screen. Pulling the chat up. What do you see? The sun, a large orange circle. It's amazing. Dark orange circle, orange dot, orange, orange, large circle, orange circle. Yup, 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 yup. Love it. All right, so Lauren's the winner. White background. I think she was the first one to say white background. And I will say that's part of what we don't ever see, right? We're so focused on what we're seeing in the middle that we might not see everything on the outer part, right? So this can kind of be what happens when we have patients at a recare appointment. We get so focused on everything we have to do. And I'm not saying we're not busy. We are busy. There's a lot that we have to do at our recare appointments. But what are the things that we might be missing because we don't have time or because we weren't taught about this stuff? I know, even though I've been a dental hygienist for a really long time, this was not anything that we really talked about back when I was in school. We didn't talk about mouth breathing. We didn't talk about snoring or sleep issues. Of course, I saw if people had crowding or an open bite, but I didn't know that that was connected to something different. And I did not learn about tongue ties. I did not learn about oral ties and how that would have anything to do with anything in my world as a dental hygienist. So when we talk about myofunctional disorders, what are they? Myofunctional disorders are habits or movement patterns having to do with people's mouths, facial muscles, cheeks, lips, tongues, chins. And these patterns or habits get in the way of how these areas are supposed to grow, especially when we're looking at children grow and develop, or just basically how they're supposed to work. So we're going to dive deep into what that actually means. But an overall view, that's what myofunctional disorders are: disruption in movement patterns due to habits or due to other things. So myofunctional disorders include thumb, finger sucking habits. It can be tongue sucking habits. You'd be surprised. We have a lot of older patients that are doing this. So if you see signs, you might want to ask your patients about that. Open mouth, resting posture, or a habit of having their lips apart with their mouth open, meaning that they're mouth breathing instead of nose breathing. Forward resting posture of the tongue. We see a lot of kids with their tongues just kind of hanging out of their mouth, or with adults, even if their mouth is closed, they might be resting their tongue on the backside of their teeth, which is going to cause issues with malocclusion. It's going to cause issues with orthorelapse or tongue thrusting. So going back to like how I got started in this world, it was really because of my children. So I didn't know, again, about any of these things when I had my kids in the early 2000s. So looking back at all of my kids' baby pictures, these are the kind of things that I see. So if you look at this picture in the chat, what do you see? What's going on with this kiddo? Open mouth, right? Open mouth posture. And do we see where he's resting his tongue? His tongue is very low in his mouth. So that's his habitual posture, right? Open mouth, low tongue posture. Cute as heck, though, isn't he? All right, then we're going to look at my daughter. So are we seeing a trend here? This is all my kids' baby pictures. They all had their mouths wide open, tongue low. My daughter was a thumb sucker. And as a dental hygienist, I didn't know that was a problem. I didn't learn in school that that was an issue. I didn't know that was going to change the way that they grew. I didn't understand that concept of any of it. I just thought they were cute. And then I noticed by the time my boys got older, what do you see in this picture with their growth? I know they really are adorable. Gummy smiles. Exactly. So gummy smiles. And again, back when I was a dental hygienist and I was practicing, I did not know what a gummy smile meant. And the way I explain it to patients now is, or even, dental professionals, we know what a super eruption is, right? So when we don't have our tongue resting up in our palate, it allows our entire maxilla to super erupt. And we have that vertical growth of that entire bone. And then we have that really high lip line, and then we have that gummy smile. So that's an issue with growth. So by the time I really figured out what was going on, all three of my kids were in ortho at the same time, which is great fun. But it's fine. They all turned out fine. I have a lovely family. They all made it. They're all fine. But, I'm really passionate about being able to find these things early because there are a lot of early signs that we can see with our patients to avoid all of the issues, right? I mean, two of my kids had to have nasal surgery because their palates were so high, it was affecting their septums and their nose. So there's definitely trickle down issues that happen when we're not catching these myofunctional issues as kids are growing. So let's talk about what causes these myofunctional issues. We kind of already alluded to some with that mouth breathing, but myofunctional disorders can be caused either by habits or conditions that interfere with the healthy muscle function, right? So it's interfering with how we want things to be. And sometimes it's from a structural problem, and sometimes it's from a habitual problem. So those are the most common things. When we see patients with myofunctional disorders, which we're going to talk about in a little bit, you're going to be like, oh my gosh, I see these things all the time. So it's for patients who have issues with their lips, with their tongue, with their jaw, their chin, their facial muscles. And the three most common causes are oral habits, structural restrictions, and airway issues. So let's break those down a little bit. So the first cause that we see causing issues with orofacial myofunctional disorders are oral habits. So when you have those kids are walking around, or adults like we talked about, who are sucking their thumb, what is happening when they have their thumb in their mouth? Number one, they're pinning their tongue down. And number two, they're shoving that thumb up into their palate. And as kids are growing, if that thumb is in there all the time, that is how their palate is going to grow, around that thumb. We know we see kids with fingers in their mouth all the time. Now, some finger sucking, I've seen on social media where people are getting really upset because kids are, putting their hands in their mouth, they're putting their fingers in their mouth. There's a difference. When we have babies and they have hands and fingers in their mouth, they are exploring. So that's how babies learn. I'm talking about our 3, 4, our older people who have the 2 fingers in their mouth sucking on it for a really extended amount of time. When we get into older children or adults, nail or cheek biting, these are oral habits that are going to affect things in their mouth. Of course, grinding, clenching. I'm sure you guys are seeing this multiple times a day. And then surprisingly, tongue sucking. I get a lot of people that suck their tongue. So these habits that adults and children have are going to cause myofunctional issues in a lot of different ways. So think about our patients who are grinding or clenching, And what is our solution in dentistry for patients who grind or clench? What do we tell them to do when we have a patient in our chair and they're grinders or clenchers? Night guard. Yeah, night guard. For the most part, night guards is what we're, recommending to our patients. And is a night guard getting down to the root cause of why they are grinding and clenching? And this is the biggest thing that I've learned diving into the myofunctional world, right? I know better now that a patient is grinding and clenching for a reason. Sometimes it's stress, sometimes it's sleep disordered breathing, sometimes it's really medically invasive things like sleep apnea, and they are grinding and clenching because they can't breathe at night. So when we're giving a patient a night guard, it's not really solving the problem. We are protecting their teeth. We're making sure that they're not going to break any more teeth, but it's not really stopping the issue because they're grinding or clenching on the night guard. And it's not really getting down to the root cause. And when we have people who are constantly grinding and clenching their teeth, from my perspective now, what I see is a total imbalance in their muscles. And then that causes a domino effect and causes pain. So part of grinding and clenching is helping to teach patients how to not do that, how to relax their muscles, how to have good oral posture in a different way besides holding their teeth together. All right, so let's talk about kids. When we see kids, they have a lot of habits that can cause myofunctional disorders. Not only extended amount of thumb sucking or extended pacifier use. We know that those are bad, and we can tell half the time when the kids come in right where the pacifier goes, into their mouth or into their teeth or right in their palate, right? But let's talk about other things that we should be talking to our patients about. What about long-term sippy cup use? So we have a lot of sippy cups out on the market, and I will tell you, you walk down these aisles and marketing is an amazing thing. So some sippy cups, these kids have to bite on to get something to drink out of it. Some kids have really long, hard spouted sippy cups. And if you think about a long, hard spout in a sippy cup, which my kids used, when they put that spout in their mouth, what is that doing? It's holding the tongue down and it's making them suck on that spout like they're still a baby. It's not really encouraging them to drink properly out of a cup. And then snacking on soft foods. So when we are giving our kids really soft foods or foods in pouches, we are not expecting them to chew. And what does chewing do? It's going to help build up their muscle, and it's going to help build up their bones, and it's going to help with their growth and development. So when we have kids in our office and we see these kind of pallets, again, when I say we know exactly where that pallet went or the pacifier goes in that pallet, those are reshaping these bones. And if we don't address it early enough, this is how the pallet's going to stay. And that's why we have so many kids going through, expansion. And not to say that kids won't need expansion. I'm just saying the pacifiers and the thumbs and these habits, it's keeping the tongue low instead of up in the palate where it should be, because that will really help with growth. All right. Another cause of myofunctional disorders are structural things, structural abnormalities such as oral ties. So we see lip ties and cheek ties and tongue ties. And when we have patients who have ties that are restricting how those structures work, it's going to change the way that muscle pattern is. So if you have a patient, and in myofunctional therapy, we want a patient to have their tongue up to their palate when they swallow. But if they're tongue-tied, they're not going to be able to do that. So that's when we see our tongue thrusters. So that's going to be your first sign. If we have people who are tongue thrusting, we need to check and see what's happening with their structure. Because a lot of times when they open their mouth, this is what we see. They can't reach their tongue up to their palate. So if we have this structural restriction, it's going to not only affect their swallow, it's going to affect a lot of different things. And we know patients with tongue ties, if they're not resting their tongue where it should be, it can affect their sleep. It's going to affect how they breathe. For some patients, it can affect their jaw. We know that if they're thrusting, it's going to lead to malocclusion. If we have young kids who are thrusting, it's going to lead to craniofacial growth issues, which is then, if we don't catch it and correct it, it's going to stay with them. And then we'll be fixing things later. And then the fourth cause of myofunctional disorders is obstructed breathing. So restricted nasal airways for a variety of reasons. It could be because we have allergies. It could be because we have enlarged tonsils and adenoids. It could be because we have a deviated septum because our palate is so high that now it's restricting our nasal space. So if you think about your palate, it's the roof of your mouth, but it's the floor of your nasal cavity. So if you have a high, narrow palate, what is that doing to your nasal cavity? It's totally restricting things and changing how those structures are going to grow. So when you have kids in your chair or adults, when you have patients in your chair and we're looking at these things and we are looking at these tonsils, how well do we think this patient is breathing? And let's take a pause. How well do we think this patient is doing anything, really? How well do we think this patient is eating? How well do we think this patient is sleeping? What's the one thing that you see in this patient's mouth that might point to an issue with mouth breathing? They have a lot of crowns. You got it, Kristen. So this patient has been a mouth breather for a long time. They probably have enlarged adenoids, which we can't see, but we know they have gigantic tonsils. They're trying to breathe. It's messing with their pH. It's messing with their entire microbiome in their mouth. And now they're walking around with a mouthful of stainless steel crowns on top of a narrow mouth and large tonsils. So we can see how these things can get off track, right? One thing is going to lead to another. So when we're talking to our patients and they're giving, if we have the right intake, it's going to give us a lot of clues. It's going to give us a lot of things that we can talk to our patients about. So when you think about when you talk to your patients, we are so lucky as dental hygienists, we get to spend the most time with our patients chairside. And when they're telling you things like, I have jaw pain, or my jaw gets tired. Is that going to be a clue for you? Because it should. That means something's happening, which we're going to talk about in a minute. But, these are things that you can talk to your patients about. Are they snoring or do they have sleep apnea, which we really should be screening for anyway? Do they feel tired? Sometimes people don't realize that they're having issues sleeping, but they know it when they get up in the morning because they can't function without a pot full of coffee. Are they having issues breathing through their nose? We're going to talk about this throughout the presentation and at the end, but nose breathing versus mouth breathing is a huge problem. And it has to be the number one thing that we are addressing with our patients, both for myofunctional reasons and for dental issues, like we just talked about with that stainless steel crown patient. Are our patients having headaches? And then in the next breath, they're telling you they're grinding or clenching, right? So we can connect those dots for them. Or are they having swallowing issues? So all of these things are symptoms that I hear from patients who are coming to see me for a myofunctional evaluation. And these are things that I'm sure your patients are telling you to chairside. So we're going to talk about how to spot myofunctional disorders in your patients in your chair, because I know you are seeing these patients all the time, and it's probably all the things that annoy you about your patients, and it's a myofunctional disorder. So when you have your patient in the dental chair, what kind of things are you going to see? You're going to have those patients. Now, I don't mean our 80-year-old elderly patients. I'm talking about that annoying patient that you have all the notes in their chart because this patient can't lay back and you can't put them too far back because they're just not going to let you. And I'm here to tell you that those patients are probably the patients who are having airway issues because as soon as you lay them on their back, they feel like they're choking on their tongue and they can't breathe. So when you're seeing these patients, these are the things I want you to think back to. Look a little bit deeper and see what's happening in their mouth that might make them feel uncomfortable about laying too far back in the chair. What about your patients that when you tell them to open wider, they open their eyes and not their mouth, right? We've all had it. I was a dental hygienist for a very long time, but I know now that these are the patients that are having issues with their jaw stabilizing muscles. And if they are having any kinds of issues with those muscles, it is going to make it very difficult for them to open and stay open for dental appointments. Sometimes it's weakness, sometimes it's tension. If those muscles are very tight from them clenching and they're on all day long, and then you just want them to relax to open wider, they can't do it. How about your gaggers? Everyone's got the tricks for the x-rays, right? Shake some salt in their mouth, lift your leg when you're putting the x-ray way back there. But these patients I tend to see have issues either with their airway or they're having issues being tongue-tied. So when patients are tongue-tied, sometimes it goes into the tissue in the floor of the mouth. And then when you're trying to put your x-ray in that vestibule, they can't handle it. They can't handle it because it's pushing on the floor of the mouth, and that's going to make them gag. So if you have patients who are gaggers, check their airway, check the back of their throat and see what it looks like. See if you can even see the back of their throat, and then check those oral ties and see what's going on there. Of course, we have our patients where we feel like we could have 3 mirrors in their mouth and you still can't get their tongue out of the way. And these people are the people that have the big tongue. But typically, these are the people that have small mouths and they just have a tongue that doesn't fit anymore because they've probably had teeth pulled. Or we have some patients who just have really low muscle tone or really no awareness of what their tongue is doing. You would be shocked how many patients come in and I will say, put your tongue up to the roof of your mouth. And without looking in a mirror, they just have no idea what's happening. So these are the patients whose tongues are all over the place when you're trying to get in there and do your work. And then everyone's favorite, tight lips, right? We want to tell them to just relax over and over and over again. And I will tell you that these people who have really tight lips during their hygiene appointments, where you cannot even see number 24 and 25, is probably because they have overactive lip muscles, overactive chin muscles, because of the way that they have to swallow. Because if they can't use their tongue properly, they're using their lip and their chin muscles, and they're just on all the time. They don't even know that they're tightening up their lips. I promise they're not doing this to make you crazy, even though it feels like it. So what about when you actually get in your patient's mouth and you're doing the examination, right? What kind of things are going to tip you off that they might have some myofunctional disorders going on? I remember being in hygiene and you would have the husband and the wife come in, and the wife would be amazing. She would be the brusher, the flosser, the mouth rinses, anything new that you recommended. And she was the one with the cavities. And then the husband would come in and he would be doing absolutely nothing. And he was the one that got to walk away with no cavities. And when I was a baby hygienist, it drove me crazy because I had no idea. I had no answers for these patients to understand. And we have come a long way in the dental field since I was in school, right? So we know now to be asking these patients, are you a mouth breather? If they are a consistent mouth breather, that is going to affect their oral pH and, again, the whole system, the whole microbiome in their mouth, and it's going to change the way their saliva works. So this is a huge myofunctional disorder that's going to affect us in the dental world, as well as gum disease. Again, these patients that are bleeding in the front of their mouth and they're not bleeding in the back. And I just never got it that, that dry mouth is going to make things puffy and it's going to mess with the saliva and it's going to create that biofilm, and the saliva isn't there to clean it away. And then here we go. And then, of course, my favorite, now that I know better, is the tongue tie. Right? So we know tongue ties are going to be a problem because do you think this patient can move this tongue with how this tie is? It is to the tip of this poor kid's tongue. And this is a really good picture to show you because if you look at his teeth, would you guess that this child had a tongue tie? Not every patient is going to present the same way, but we need to be screening for these and we need to look at everything, not just say, oh, his teeth look great. We need to ask about how is this child sleeping? How is this child eating? Is this child able to swallow pills if he needs to? What kind of issues is this child having with having that tongue tie? And even if nothing else, we can see that this tongue tie is attached to the lingual papilla between 24 and 25. Over time, do we think that is going to be a problem? 100%. All right, let's talk about ortho relapse. Let's talk about our patients who come in and had ortho in, high school, and then they had a relapse in college, and then they got Invisalign as an adult, and they're sitting there tongue thrusting. This is a big reason why patients have ortho relapse because their muscles aren't behaving to help keep the harmony in their mouth. And I've seen patients with tongue thrusting issues who have fixed and removable retainers and the teeth still move. Your tongues are very strong and it is going to relapse those teeth no matter how many retainers you try and put in there. What about your patients who have worn anteriors and you're constantly repairing either incisal edges or those class fives? You get a patient come in and the doctor's going to say, oh, they need like 8 class fives done. And then they keep popping off. So what's really the underlying issue? What is really happening with these patients? And typically it's from grinding and clenching because of unstable jaw muscles, grinding because of an airway issue. But if we don't solve that, then we're going to continue having the clenching, which is going to flex the teeth and just cause those to continue to pop off. I know we already touched on tonsils, but I don't remember being back in school screening for tonsils. So looking in the back of the throat, what are you seeing? What else besides the tonsils are you seeing in the back of this throat? What else do you think is a little funky back here? Yeah, we have that uvula moving off to the side. Do you see how long that uvula is for a little one? So if we have patients with uvulas that are going off to the side, that could be a neurological issue. If we have elongated, thank you, uvulas, what is happening with this patient? They're snoring. They're snoring at night and they're having a problem. So we need to be able to screen for these things in addition to making the proper referrals out to other healthcare professionals who can take care of these things. We know that we're not going to be able to take care of everything, but if we're noticing these things and we can refer out, it's going to help this patient breathe, sleep, eat, and tolerate our appointments a lot better and a lot more comfortably. Jaw pain. How many of your patients are coming in with jaw pain? And I'm not saying every single patient has a muscle issue with jaw pain, but a lot of times the muscles are part of it. Yes, we have the disc, we have the structural joint and bone part, but if it's connected to how they are swallowing and they're thrusting their tongue forward, it's definitely affecting their muscles as well. So just because we have a patient with jaw pain and we put them in a night guard or even maybe an orthotic, if we're not addressing the underlying muscle component to it, it may not be the total solution for these patients. So why should dental offices really care about this? Because many of your patients are dealing with many of these things. And I'm sure by just watching that, how many of you are having these dots connected in your brain, or you're thinking of a patient like, oh, now I know what's wrong with this one. Now I know why that patient can't lay back. Now I know why this patient can't loosen up their lips. Is all this making sense to you guys? I'm looking in the chat. I don't see anything. Yeah. Awesome. All right. Thanks for staying with me, guys. So myofunctional disorders affect, I would say, probably 80% of your patients in some way or another. And just because things are common doesn't mean that they're normal, right? So when a patient comes in and they say that they're snoring, that's not normal because it's probably never going to get better. If we have a snoring patient, it's more than likely going to lead to sleep apnea at some point. I've had 40-year-old men come into my office and tell me that they will not eat steak in a restaurant because they feel like they're going to choke on it. Not normal. We have patients come in all the time who are breathing through their mouth. Not normal. And honestly, not being able to tolerate a dental visit because of these things is not normal. So let's talk about the things that you can do chairside or on your intakes to just start the ball rolling. You know, you might not be in an airway practice, and that's okay. You might not be a myofunctional therapist. That's okay. There's still things that we can do to screen patients, and we can give them suggestions for things that might help them a lot. So we're going to talk about 2 sleep screeners that we can add into our intakes. And then I'm going to give you 2 options for chairside screeners that you can use. One is going to be from another fellow myofunctional therapist, Pat Brinkman-Falter. And then I'm going to give you a handout, and it's going to have a different type of screening. So you can choose whichever one you like, and you can use a little bit of both of whatever you like. But these are going to be the red flags that you're going to see. So like we talked about, we should be screening our patients for sleep. So the Epworth Sleepiness Scale and the Fatigue Severity Scale are 2 scales that we can use that are research and evidence-based to at least do a screening for patients to open the door to talk to them if they're having sleep issues, right? So you can see this is 8 questions, very simple, from 0 to 3, and then it will give you a cutoff for what the score is. If your patient is at that score or above, you're going to want to refer them out. And we're going to talk about referrals in a little bit. This is the fatigue severity scale. Again, 9 quick questions. They're going to rank it 1 to 7, and you're going to add up the scoring again. If it's 36 or more, it could be a possible issue, right? So this is for daytime fatigue. The other is for sleeping. All right, these 2 are going to be your in-office observations. And the SPOTS assessment is what my colleague came up with. Her name is Pat Brinkman-Falter. She's an RDH, and she's a certified orofacial myologist. She practices in Nebraska. And I love her assessment because I feel like it's really easy. And I feel like most of these things are things that you're doing anyway with your patients. So for SPOTS, we're going to start with the first S, and that S stands for speech. So if you are hearing patients who are having difficulties with their R or with their S sounds when you're talking to them, that's a hint that the back part of their tongue isn't working as well. So they might have some kind of a restriction. Now, when you talk to your patient, you are updating medical histories, you are talking to them about their families and their vacations and all kinds of things. So you're going to be able to catch these things very simply. The P in SPOTS is for posture. So how I work it in my practice is I walk behind my patient. So I let them walk in front of me when we're walking back to the room. So I can see if they're having any issues with, do they have a gait issue? Do they have an issue where they limp and they're moving over to one side? And then when I sit them in the chair, what's beautiful is I have this perfect profile view. So I can see if the patient is having issues with head posture. So forward head posture is a really big thing. And when we see patients like this with their head coming forward or their shoulders really tight, this is going to affect, of course, their head, their neck, their shoulders, their back. These might be the people who have headaches and pain in the back of their head. But this is also going to affect how their jaw functions. So paying attention to what's happening with this posture is really important. And a lot of us are like this, right? We're on our phones, we're on our computers, we're not paying attention all the time to having great posture. So putting those intake questions together with what you're seeing in your patients is really important. And this is another picture. So ideally, we want to see the patient's ear over their shoulder. So the middle of their ear, where our opening is right above the lobe, should be over your shoulder. So you can see with this patient, her head is forward because her shoulder is all the way back here. So she's definitely got some forward head posture going on. All right, the O in spots is occlusion. This is a simple one. This is something you guys are doing anyway. So we're checking occlusion. Do they have open bites? Do they have cross bites? The bigger question is why? Why do they have these bites? How did we get here? So when we have open bites up in the top, this is from a pacifier. When we have a really deep bite where we're totally occluding those mandibular teeth, something's happening there. Do we see all the tipping that's happening with those teeth? We're having collapse of those arches. Really tight baby teeth. What is that going to tell us? What does it mean when we have this beautiful baby Hollywood smile where all those teeth are nice and close together? Parents love it, but what does that mean? It means there's not enough room. Thank you, Lori. I mean, we can tell patients right here that we know that once they start getting their adult teeth, they're not going to have room for them all. So why are we waiting on orthodontics for these little patients? Why are we waiting on expansion? We need to expand their jaws and open things up so they have the room for their teeth to come out. And then, of course, we have my friend here who was a tongue thruster. So you can see she was a clencher. You can see all the work she's had in the back. You can see all the wear on her teeth. This is the kind of things that we're seeing all the time, right? All right, in spots, the T is tethered oral tissues. So we are going to be checking patients' upper lip, lower lip, their tongue, and then we're going to check for 4 buccal ties because this can be a big part of the puzzle. And it can be tricky looking at these things, right? And it can sometimes confuse us. All of these patients have a tongue tie. If you look at the middle picture, that's probably the most obvious, right? Anybody can look at that and say, oh yeah, that's a tongue tie for sure. But what about the 2 on the outside? The one on the end, you can see that it's pretty short and it's not allowing even the front part of the tongue to get up to the palate, let alone the back part of the tongue. And the first picture might be tricky, but I want you to look at how when she lifts her tongue up, how the floor of her mouth lifts up. And that's a really good indication that she is having a compensation, meaning if we held the floor of her mouth down and didn't allow her to recruit those muscles, she wouldn't be able to get her tongue that high. So that is still a restriction. All right, that last S in spots is probably the trickiest one and one that you would never look at, but this is a really easy one that you can do. So when you ask your patients to bite down with their lips open and swallow, it's going to tell you if they need to use their lips and their chin to do their swallow or if they can just swallow with their tongue. So we want patients to be able to get their tongue up to their palate and use the tongue to palate seal to swallow. And most of your patients will not be able to do it. They're going to be wanting to really tighten up their lips, and you're going to see their tongue thrust forward, and that's going to be an indication for you. So watch this video. You see how everything is tightening up? Those lips are getting tight, the chin is getting tight, and that tongue is thrusting forward. So another really amazing screening that you can use chairside is called the Ferris 6. For kiddos, it's just the Ferris 6, so it would be this front sheet. And then for our adults, it's Ferris 6 plus 4. So it would be the front sheet and then the back sheet. So again, this is just a different type of screening. This is by Dr. Zaghi, who is a god in my world. He's an ENT and a sleep doctor who does a lot of research on myofunctional therapy, and he really helps standardize things in the field, which is really, really important. So this is another, again, you can see how easy it is. Is a patient a mouth breather or not? Can they breathe through their nose for 3 minutes? Yes or no? Do they have chin strain? Yes or no? So very easy once you can get through this, and this download will be in your guide, which I'm going to have the QR code up in a minute for you guys to be able to get that. So what do you think the effects are of these myofunctional disorders? When we are in the dental office, what kind of things are you going to see? You are going to see these disorders contribute to open mouth posture. You're going to see your patient's tongue thrust. They are going to report disrupted sleep or sleep apnea. You're definitely going to see malocclusion. You might see orthodontic relapse. And of course, an increased risk for caries and periodontal disease. Over time, especially with kids, these patterns can influence facial growth, how their airway develops, and then for everyone, really overall oral health. Is all this making sense? I hope I'm connecting some dots for you guys. Are you like ready to go back to your office and just go nuts on your patients? Are you thinking of all the patients that you can bring all this information to? Awesome. All right, so the effects of oral facial myofunctional disorder. So me being an IBCLC, I do see a lot of infants. I see a lot of babies who have a lot of feeding challenges. So for young babies, these are the things that we see if they can't use their tongue properly for whatever reason, whether it's an oral tie or low muscle tone or whatever the issue is. They're going to have difficulty latching no matter how they're trying to feed. They're going to click during feeds because they can't get that tongue to palate suction to do a proper swallow. That tongue's going to keep falling down and making the click sound. They're going to have milk leaking out of their mouth because if they have ties around their lips and their cheeks, they can't keep a seal to keep the milk in their mouth where it's supposed to be. They're going to get reflux-like symptoms. They're going to be gassy and cranky because they can't get the tongue to palate seal. So they're going to be getting lots of air down in their tummies. And then we're going to see an early preference for mouth breathing because of that domino effect of the tongue being low and then breathing through their mouth. And it even will change a baby's structure and they will be congested and not be able to breathe through their nose also. Oral habits. So a lot of times, like some of our kiddos who come in who have these oral habits, sometimes they have oral habits for a reason. So if we have kids with very enlarged tonsils, sometimes they will suck their thumb or suck their fingers to actually hold the tongue down so they can breathe better. So again, these are just little tips that you'll be able to look for if you're seeing certain habits. Are they sucking something for a reason? Is it to keep their airway open so they can actually breathe? Another effect is going to be growth issues. So if we can't keep our tongue in our palate for whatever reason, you're going to see, like you saw in my kids, they're going to get narrow palates, they're going to get gummy smiles, they're going to have crowding because they don't have the stability of something helping those jaws grow properly. In older patients, we're going to see ortho relapse. In kids and adults, we're going to see snoring, daytime fatigue. Now, for adults, daytime fatigue shows up in us needing caffeine. For kids, daytime fatigue shows up in ADHD. They have a hard time sitting still when they are not getting consistent sleep and good rest. And then patients we see with chronic strain. So grinding, clenching, TMD problems, headaches, poor sleep quality, just overall tension that they're carrying in their body. And it can even go down to head, neck, shoulders, all the way down the line. So now we're going to get into the myofunctional evaluation that we do. So we screen patients for breathing. Of course, we want to know if they can breathe through their nose. That's got to be number one. We want to see if patients have issues with their TMJ. Are they grinding or clenching? Do they have pain? Is it bilateral? We check every muscle individually because this is what shows us where things are tight, where things are weak, and then it points to exactly what we need to plan for these patients so they have an individualized plan. And then we watch the function. So we watch our patients walking, chewing, talking, drinking, because then it puts everything together and mechanically shows us what needs to be corrected. All right, so I wanted to bring tonight some practical solutions that you are going to be able to bring to your patients if you are seeing them having issues. So let's say you have a patient in your chair and they're having a lot of issues breathing and they can't breathe through their nose. What are some things that you as a hygienist can suggest chairside for these patients to help relieve these symptoms? So the first thing I love to start with patients are nasal sprays or neti pot. So we can have just a very simple saline. We can have a clear spray. This has the xylitol in it, or our neti pots. So if we are constantly keeping it moist and clean, it's going to help our patients keep the inflammation down, hopefully, so then they're able to breathe through their nose. Some other things that I love to recommend to my patients are nasal dilators. There's all different kinds. There's all different shapes and sizes. The mute ones actually go up in the nose. Some patients love it. Some patients hate it. The Breathe Right strips, if you've ever used these are kind of like a Band-Aid that goes on your nose. So sometimes that will work for a patient, but sometimes we need something a little bit stronger. And that's where these intake bands are absolutely amazing because they work with a magnet. Thank you. A magnet. So part goes on your nose and then there's a magnet on the strip. So when you put the strip on, it actually will pull your nose open. It works amazingly. I also wanted to touch on mouth tape. So mouth tape is amazing. This is our lovely Amanda who sent me a picture of our Guru Nanda tape. Mouth tape can be an amazing thing for patients to use, but I will say I typically recommend patients use it during the day first, because if a patient is really used to mouth breathing and then they tape their mouth shut, it can make patients very nervous. It can make them feel claustrophobic, like they're not getting enough air. So be really careful with mouth tape. I know people are reading it all over the internet about just taping your mouth shut, but if we have patients who have real obstructions, right, and then we're recommending mouth tape, that could be a big problem. So make sure we're doing daytime before nighttime and make sure patients have the ability and they don't have obstructions before they're taping their mouth shut. What about their tongues? So asking patients where they hold their tongue at rest and how it functions can be a really big first step into awareness and what they are doing. So has anyone here, have you guys been checking where your tongue is at? Where do you rest your tongue when you're relaxing? Where do you put it? Do you put it on the roof of your mouth? Do you put it on the floor of your mouth? Is your tongue resting on the backside of your teeth? So we want your tongue, we want the tip of your tongue to start on your incisive papilla. And then we want the rest of your tongue relaxing up in your palate. Relaxing, what is that? I like it. So we don't want your teeth pushing on your tongue pushing on your teeth, because that can cause problems, right? It can move teeth for some people. We don't want that. So when we're working with patients, some things that we can teach them is for tongue to spot. These myo spots are great because they're kind of like the xylomelts where they actually will stick to your tissue. So they can put a little spot on their incisive papilla, and that can start them getting used to having the tip of their tongue up to the spot, right where it should go. Then we have these Replenish bottles or the Myo straws. I really like these for patients to get the back of their tongue working. So most patients don't have issues getting the front of their tongue up to their palate, but a lot of patients have a problem getting the back part of their tongue to their palate because it's weak and it's never been up there before. So those muscles, to target those muscles, we need to have very intentional things that we can use. And I do like the Replenish. And then, of course, referring to your local myofunctional therapist, right? So we have a few things that we can give to patients, but we want to make sure that we're sending them out to have an overall evaluation and really get some good therapy. I also wanted to touch on collaborating with other healthcare professionals. So, I mean, I think in my office, I probably send away 50% of the patients that come to see me for consultations because I am not the first place that they should start. If I have a patient come in that cannot breathe through their nose, they will not be successful with myofunctional therapy until they get that addressed. So they have to go see an ear, nose, and throat doctor and get that figured out, or an allergist first, before we can even start myofunctional therapy. If I have patients, I co-treat a lot with chiropractors, physical therapists, craniosacral therapists. I work a lot with pelvic floor therapists, which if you would have told me 10 years ago I would be collaborating with pelvic floor therapists, I would have told you were nuts, because I never thought that that connection would have been made. But I refer back and forth a ton with pelvic floor therapists. I work very closely with speech language pathologists that are local to me. Occupational therapists are wonderful for, kids that are learning to eat. Of course, our sleep medicine physicians, if we have patients that need sleep studies. If I have a patient, again, come in with severe sleep apnea, I need to make sure that they can breathe at night before we are attempting to do myofunctional therapy. Of course, as you want to refer out to a certified orofacial myologist through the IOM, we have a wonderful directory. And that's where you can find someone who's actually had third-party testing for the work that they do and make sure they know what they're doing. So I'm going to give props to my organization. And then if we have patients that need airway-focused dentists, you're going to want to connect with someone who's airway-focused or an airway-focused orthodontist, right? We don't want to be pulling teeth anymore. We want to make sure that we are able to help our patients by expanding so they can breathe better and help them as a whole. So let's talk about how myofunctional therapists can help. So we have basic overall goals that we want to achieve with our patients. That's really good rest posture, reducing any muscle compensation, which we kind of talked about, right? So if we have a patient who's lifting the floor of their mouth when they're lifting their tongue, that's a compensation. If we have a patient who's swallowing and they're using their lips and their cheeks, they're compensating. So we check those for those in the evaluation, and then that's what we help them through with their therapy. And then we're correcting the oral phase of swallow, meaning we want them to be able to get, again, their tongue to palate instead of thrusting for that swallow. I think we went through this a little bit already. So we're checking breathing, TMJ, muscles function. Yeah, we went through the slide already. So this is basically what we're screening for. And then to get like a little bit more into depth, I just wanted to give you a little peek inside of a myofunctional assessment so we know exactly what we are targeting. So it's very much like when we do our hygiene check, right? We're doing our probes, our intraoral photos, we're doing our charting. When we do our myofunctional evaluation, it's the same thing. So this is our checklist. This is what we're looking for. We're checking their masseters. Are they tight? Are they tense? Are they clenching? We're checking their chin, their TMJ, lips, cheeks, tongue, which we talked about a ton. We're looking at their posture. We're looking at breathing, which we're going to talk about at the very end. We're going to check their nares. Is their nose open, or do they need something to help with the collapse of their nose? And how are they swallowing? Are they thrusting? So again, here's some, we already looked at tongue ties. These are some lip ties. So depending on where that lip tie is attached, that's going to determine, is that going to be a referral out? Is it pulling on papilla? Is it really low where it's in between teeth that it's going to cause a problem? Here's some different tongue ties. So it just shows you how different patients can present and what these tongue ties look like. Again, we have a patient with a tongue tie attached to the tip of their tongue. And then we have another patient where, oh, they can lift their tongue up, but now that we know better because we've talked, right? Look at how much that patient is lifting the floor of their mouth. Look at that, those salivary ducts being pulled up, and look at how short that frenum really is. We take measurements. So this is part of what Dr. Zaghi's plan is. We check patients' mouths. We want to see how wide that they can open. And then we also take measurements when the patient has their tongue up to their incisive papilla. And then we take a measurement as they are suctioning their tongue up to the top of their mouth. We're checking for overjet. So anything that we can measure, anything that is trackable and able to gather data, especially when we are seeing a patient for a while and we want to continue to show things improving, Lots and lots of measurements are helpful. So when we're talking about myofunctional goals, these are the very like high level 4 goals that we're working with patients about. Number 1, always nasal breathing. They have to be able to nasal breathe. And why is that? That's because the second goal is we want their mouth closed. So their mouth has to be closed and their lips have to be closed to have good rest posture. And if they can't nose breathe, they're not going to be able to sustain that. The third goal is tongue to palate at rest. So your full tongue should be very gently resting in your palate when you're not using it to eat, drink, speak. And then making sure that our tongue is going to our palate for our swallow so we are not thrusting. So first goal, nasal breathing. How do we get there? We have to teach patients. I just had a patient last week who's 5 years old, and we had to teach him how to blow his nose. He didn't know how to blow his nose. Sometimes it's just as basic as that, right? Sometimes we are really great during the winter, and then spring comes and everything goes loose, right? Because everything is blooming. So we have patients where we're managing allergies on top of it. So really being able to assess your patient for what their needs are, and especially at that time. I will say half of the kids that I see are mouth breathers because it's a habit, not because they can't nose breathe. It's because they got sick at some point in their childhood and they forgot. They just forgot. So simple teaching sometimes. Sometimes it's not so simple. So I work with intake breathing. These strips are amazing. And the beautiful thing about intake breathing is if you are a healthcare professional and you scan this QR code, they will send you a free kit to try. So if you have issues with nasal breathing, if someone you love has issues with nasal breathing, sign up for it. They will send you the kit. And like I said, it's 2 little magnets, little Band-Aids you put on either side of your nose. And then when you put the strip on, it just opens up your nose so wide so you're able to breathe. This is huge, huge number 1 goal for our patients. All right, second goal, lips and mouth closed. How do we get there? How do we get there? Again, we have to make sure that they can breathe through their nose. I'm going to show you how I use Guru Nanda in my practice. And then sometimes we do work with lip tape. We work with different exercises such as holding popsicle sticks between their lips and using a timer to make sure that they can do that. But that's once they're really comfortable with breathing through their nose. So Guru Nanda is amazing. They have a ton of amazing products. So this is the QR code to their website, so you can check out what they have. And I know all of you have probably seen all the amazing things that they've been doing giveaways for. So I got really creative and I wanted to figure out how can I use these tools in my myofunctional practice. So I love their toothbrushes because, and of course, you know, they're wonderful for brushing teeth, but this sensory input to get muscles to kind of wake up, right? When we have patients who come in and they have no idea what they're doing with their tongue, we use these toothbrushes on the top of the tongue, on the top of the palate, on the sides of the tongue to get it moving where I want it to move. So when we use sensory input with these toothbrushes, what happens is the tongue is going to go where I'm putting that input, and it helps patients learn. This is my other favorite tool. So we got our boxes, right? They did their giveaways with all of their tongue scrapers. What do I use tongue scrapers for? So we have an exercise, it's called fat tongue, skinny tongue. And I have so many patients that just cannot get it. They don't understand the concept of having a fat tongue first and then pointing your tongue and making it skinny. So I use this tongue scraper so they can feel their tongue on the inside of the tongue scraper. And then when they make it skinny, the sides of the tongue come off that tongue scraper. So again, it gives them that sensory input to understand what we are doing. All right, third goal, tongue to palate at rest. What kind of things are we going to talk to our patients about? I use a lot of these tools because for some people, it's just, we have to get through exercises to make it their normal, right? The ultimate goal of myofunctional therapy is for all of this to be normalized in their habituated state. And this is just how they are now. But for a lot of people, we need to work through it, and we need to use these tools and exercises to get to those normalized states. So we talked about the myospots, how we use that for the front part of the tongue. I really like these other tools. The middle one is a MyoMunchie, and the last one is a tool from a company called MRC. So both of these are tools that we can use in patients' mouths. And if you think about, these are night guard shaped things that a patient's going to put in their mouth. It's going to help them with multiple goals, right? It's going to help us with lip closure. It's going to help us make sure their mouth stays closed. It's going to make sure that they're nose breathing. And both of these things, the MyoMunchie has a little tab and this other tool has a big tab, but that is the little rest. It's going to help give that cue for the patient to put their tongue up at the palate where it's supposed to be. And then the last one is getting that tongue to palate for swallow. So again, when we have patients, I mean, imagine those pictures that you've seen tonight with the patients where they're tied to the tip of their tongue. When they go and get a tongue tie release, whether it's in 1 or 2 visits, they still have to they have to figure out how to use the back part of their tongue, right? And so we use a lot of exercises to target the back part of their tongue. But this myofunctional straw is amazing because when they use the straw has to go on the length of their tongue, and the back part of the tongue is what has to be activated for them to get the liquid up out of the straw. And if they use it properly, it can really help strengthen the back of the tongue and the back of the throat as well. This other cup, these cups I love because they're little baby cups. They look like little shot glasses. They're totally made of silicone, but these little cups help our little patients learn how to swallow properly. By not using spouted cups and by using an open cup, they're learning to swallow how we swallow. And that's really where we want to get them. And I know open cups are hard for a lot of parents because they're messy and they're going to spill, but that's how they learn. That's how they learn. They'll get better. All right. So if you guys scan this QR code for me, I put together a handout for you. But in this handout, there is actually a blank case study sheet. We're going to go through one of my case studies now, and I want you to work through it with me. I want you to see what you think is happening with this patient. If you go to the QR code and you hit that with your camera, it'll bring you to the link. And then you'll be able to get it. If you're on your phone and you take a picture of it, you'll be able to access it later from your picture. I'm sorry, I don't have a link. I'll have this up again for you guys at the end so you can grab it. All right, so we are going to go through a myofunctional case study. I'm going to give you a little bit of background. This is my patient, Michelle, and I want you to look at all these pictures of Michelle and just pay attention to what you're seeing. And then I want you to put in the chat what you're seeing so we can have our eyes on everything together, okay? So Michelle came to me. She's 24 years old. She has jaw pain, and she has neck and shoulder tension. She was referred from a dentist for an evaluation of an oral tie. Thank you, Sophie. Thank you so much. She has GERD and anxiety and depression, and she is medicated for both. All right, awesome job, guys. So we are already seeing asymmetry in her face. We are seeing posture totally off. We're seeing a tilt to her head. We're seeing that one shoulder higher than the other. Great job. All right, let's talk more about Michelle. Michelle wants her tongue tie to be looked at. She reports neck and shoulder tension daily because she's stressed from work and she works out. She reports jaw pain and admits to grinding and clenching. And she has to take melatonin to get to sleep. And this is the thing that got me about Michelle. She's had GERD for 5 years and has been medicated for that for 5 years. This girl's 24 years old. Awesome. Poor swallow pattern. So she's swallowing air because her tongue can't get up to her palate when she swallows. She's probably having jaw pain because she's grinding and clenching. And neck and shoulder tension. Like, we don't know the whole story yet, but we do know that she's already holding herself, her body, right, in a strange pattern. She's got poor posture. All right, so here's her tie. She was diagnosed with a tongue tie and then an upper and a lower lip tie. So all these measurements, I didn't even get into the math part because I know hygienists hate math. I know I do anyway. So if you're interested, you can email me. But if you look at her tie, this is a classic Eiffel Tower tie. So we call it an Eiffel Tower because it's long and skinny at the top and then it flares out into a wider base at the bottom on that alveolar ridge. Let me go back to the slide one more time. These are your gleekers, guys. When they're moving their tongue and they're gleeking all over you, it's because the floor of the mouth is being lifted up and it's being held under tension. All right, here's her upper lip tie, her lower lip tie. So you can see this upper lip tie, it's got like 2 attachments in here. It's very low in between that papilla. And then the lower one, the doctor deemed to be too high in between 24 and 25. So they wanted to release everything. So she started with myofunctional therapy first, right? We want to get her in a place where she's good and ready for a tongue tie release. We don't want patients to go for tongue tie releases before we're able to work out some of that tissue under her tongue. We want to make sure that all the nerves and the blood vessels come back in the body of the tongue, and what's ready at the forefront of the tongue is what needs to be released. So when we went over her myofunctional, this is what we saw. She's got pain on both sides. She's clenching, discomfort upon waking. What does that tell you? She's got deviations. She's got temporal headaches twice a week. So if we have clenchers and grinders who are really working here, what do we think is going to happen here? That's where those headaches are coming from. She had a very hard time moving her tongue without moving her jaw. Her lips were weak. And she had good mobility of her tongue, but she couldn't suction it to her palate. And she had a scallop tongue as well. So let's look at a few more pictures. I'm going to tell you about facial thirds. So ideally, we want it to be like even thirds when we're looking at a patient. So when you look at her thirds, what you're going to see is that her upper third is the biggest one. And the middle one gets smaller, and then the lower one is the smallest. And this is what you're going to probably see really consistently with your patients. A lot of your patients are going to have mid-face deficiency, and they're going to have even smaller jaws. You see that her eyes are off. So we have that asymmetry there too. Here's her floor of mouth. Pretty unremarkable with the tongue just sitting there, right? That looks like a normal floor of mouth. Look at the palate. It's hard to see in the picture, but you can see it's vaulted a little bit. Now, she told me she was a thumb sucker. And then she showed me her thumbs. So she has a souvenir for being a thumb sucker for so long. She actually sucked her one thumb longer than the other thumb. Is that not the most hilarious thing you've ever seen? All right, here's her retraction pictures, which again, when you look at her pictures, not really a ton of signs there, right? Doesn't look so bad. Again, here's her pictures, that Eiffel Tower attachment. I always like to describe what I see, so that's what I put in my notes. There's her elevation. Does that look familiar? She's lifting that floor of mouth up. Now, when we have patients in, I talked about watching them chew, and I watch them swallow, right? So when we have patients chew and swallow, what she showed me in the first picture is she chewed up her food, and then right before she swallowed, she opened her mouth. Do you see how she's swallowing from her teeth? All of the food is left on her teeth. That is very common for people who have issues with their tongue tie. and they can't move it where it needs to be. So they swallow from their teeth instead of really using their tongue. And then this is a really telltale sign in that second picture. That's after one swallow. You can see all the residual food on there. So I'm kind of giving away the treatment plan, but I mean, is this what you guys would do first? What would you ask her? What kind of questions? Is there anything you want to put in the chat or any questions about this case in particular? She did have some incisal wear. She did. So my first referral for her was body work, right? She came in with pain and I wanted to make sure that we could get her out of pain. I try and get CBCTs. I do work with a lot of doctors who have CBCT machines, so I do like those because they show you a lot of information about patients' airways. Who do I refer to for body work? It depends. It depends on the patient. It depends on what's going on. It depends on where they live and how close they are to me, but I refer all over. I really like chiropractors because they kind of get me, but I work with craniosacral therapists too, and we have some good PTs around us too. So once she went for body work, then we started myofunctional therapy. So we started myofunctional therapy again to get her tongue up into her palate. So she was able to hold her tongue up there because, you know, in the evaluation, she wasn't able to. We want to get the CBCT so we can get a good visual on what her airway looks like, what her measurements are. And then she went for releases of her tongue, upper lip, lower lip. And because of her CBCT results, we told her she might need expansion in ortho. So for some patients, once we release the tongue, if they don't have enough room in their mouth for their tongue, sometimes they need expansion. So for her, we started myo sessions. We worked on breathing with her. We worked on making sure she could move her tongue separate from her jaw, lip strength, jaw massage, making sure she can suction her tongue up. And then post-op goals, right? So she went for her release, but what are we going to do now? We need to work on the back part of that tongue. And that back tongue is not used to moving when we have oral ties. So we need to strengthen those muscles and get that back of tongue moving and working, and helping her get really good rest posture, making sure that she can hold her tongue up to her palate for resting. And then, of course, forming a proper bolus, meaning her chewed up food can come onto her tongue where it should be instead of swallowing from her teeth and then swallowing with no compensation. So this patient in particular, once she was done and completed, she went off her GERD medicine with her doctor. That was not anything that I told her to do, but because she was swallowing better, she was able to go off her GERD medicine. Her jaw pain went away, and she was able to, have really good rest posture and just feel better, not have that jaw pain. She did not have a challenging time mouth breathing. A lot of people who are typical mouth breathers, she didn't have a problem nose breathing, but she just had to learn how to nose breathe slowly, which we're going to talk about a little bit if we have time at the end. So I love this quote. When dental teams begin to recognize the patterns behind breathing, posture, and oral function, you're really just not treating teeth. You're treating the whole patient. You are treating this entire patient's health and just how their whole body feels, which is an amazing thing. I want to ask Social 630, do you want me to run through breath work for RDHs? Do you guys want to learn a little bit about breath work for yourself?
Yes, that would be awesome, Joy. We would love that.
So I put in a few slides just to kind of bring a little bit of awareness to breathing, because again, when I work with my own patients, whenever we talk about breath work, what's the first thing we think about? We think about yoga, right? And how we're breathing at yoga. We literally breathe all day, every day, and it is something that we need. So we're going to just work together to find an awareness about your own breathing. We're going to learn how to control your breath to improve focus, reduce tension, especially when you're at work. And I'm going to show you a couple of simple, really easy techniques that you can use every day when you're driving to work, when you're at work, whenever it'll help you relax. So the first thing I want to do is just have everyone kind of pay attention for a minute. And I just want you to close your eyes and I want you to think about one of the things that we do automatically and we don't think about, and that is your breath and how it is entering and how it is leaving your body. And I just want you to think for a minute and kind of take these notes on how you feel. Now, I've given you a lot of hints today on how you should be breathing, so don't lie to yourself. And then when you're ready and you've had your observation, I want you to tell me in the chat what you noticed. I want you to tell me, are you a nose breather or are you a mouth breather? And I want you to tell me if you're a chest breather or a belly breather. Awesome. Thanks, guys. All right, so let's talk about this. We know that we have talked about the differences between nasal breathing and mouth breathing, right? We have physiological differences. And if you guys are any kind of a nerd like I am, there's this amazing book out there called Breath by James Nestor, and it will actually blow your mind talking all about breathing. So nose breathing is amazing because it filters the air, it humidifies the air, it warms the air, it helps your oxygen absorption, and it helps with nitric oxide, which is amazing for so many processes in your body, including your cardiovascular system, for men, your reproductive system, lots of different things. So nose breathing is going to support overall health. It's going to help you have better posture. It's going to help with a ton of things. Mouth breathing, as we saw tonight, is going to be a problem with dry mouth. You're going to have a bigger risk of infections, whether it's tooth decay or periodontitis. It's going to decrease oxygen absorption. It's going to definitely disrupt your sleep and cause snoring, among many other things. So in this book, Breath, the man who wrote it is actually a journalist, and he did a 10-day experiment on himself between mouth breathing and nose breathing. So he went in as a nose breather, he got all of his stats done, and then he had them totally tape up his nose for 10 days, and he had to be a mouth breather for 10 days. And he went back to the doctor. And tell me in the chat what kind of things you think changed for him being a mouth breather for just 10 days. Awesome. So his blood pressure went up multiple points. His pulse went up multiple points. His oxygen saturation totally went down. He had brain fog. He felt terrible. His sleep was terrible. Yes, Breath by James Nestor. This is a must read. Totally changed his life in 10 days. Now think about your patients that are chronic mouth breathers who just can't nose breathe. These are the people that are crabby and they can't help it. These are the people that have had craniofacial changes. And if you look at this picture from the Breathe Institute, you can see what is happening to our patients who are nose breathers versus mouth breathers with their facial structure as they grow. This is what's happening to our patients. So it's not just what's happening on the outside, but it's what's happening on the inside. So it's definitely a twofold thing, and it's something we all should know. All right, so let's go to the next slide because we're going to talk about chest versus belly breathing and really understanding the mechanics. So if you put in the chat that you're a chest breather, that means you're not using the one muscle that we have in our body to help our breathing, and that's our diaphragm. So our diaphragm is under our rib cage, under our lungs, and it actually should be moving as we breathe. So when we put a hand on our chest and a hand on our belly, when we are breathing, we really want to focus on seeing that belly lift up and not our chest. Chest breathers that I treat tend to have more anxiety. They have more behavior issues. It puts you in fight or flight. It contributes to muscle tension and fatigue if you are a chest breather. It's more shallow breathing. It changes the way your oxygenation actually works in your body. If you look at that first picture, this is how your diaphragm works. It literally moves up and down. It helps empty your lungs. It helps work your diaphragmatic muscle, which if you can see that yellow muscle in that picture, it's not just in the front. It's an umbrella-shaped muscle that goes around your entire rib cage from front to back. When you use your diaphragm to breathe, it also helps your heart. It helps your heart pump the blood from your heart throughout your body. If you look at that first picture, the second picture, exhalation, do you see how high up that diaphragm goes? It makes a huge difference for mechanics and for how you feel. So belly breathing is really what we want. This is going to help you relax. It's going to help get that vagus nerve going to help bring that relaxation in. Tongue to palate is going to help with your vagal tone and just really help you relax. So now I want you to try how the right way is, right? So I want you to sit, I want a hand on your chest, I want a hand on your belly, and I want you to try and breathe again. Close your eyes, try and have your tongue up to your palate. I want you to take a breath through your nose, and I want you to feel your belly rise. And now I want you to tell me in the chat, was that hard? Was that hard to do? Did you really have to concentrate on that? Especially if you were a chest breather before. If you were a nose belly breather, you kind of got it. But it's hard, right? You do have to think about it. You have to concentrate. Whoever thought we would have to think about how we breathe? It's crazy. So this talks about how your upper chest breathing is going to put you into that fight or flight, that it's going to put you into the sympathetic nervous system, and it's going to make you on edge. It's going to make you more anxious. It's going to make you more irritable. Where if you can tap into that belly breathing, it's going to help the rest and digest. It's going to help you relax. It's going to help you manage your stress a lot better. So these are just a few patterns that I talk to my own patients about when we are doing breathing focused exercises, which I have a lot of people that come see me who are mouth breathers and they are chest breathers. And when we try and switch that over, when I say we really want you to nose breathe and we really want you to belly breathe, again, it will put some people into a panic. So we have to go slow. We have to go slow when we do this. So when we get to box breathing, we don't start at 4, 4, 4, 4. We might start at breathing in for 2 seconds, holding for 2 seconds, breathing out for 2 seconds, and then we might bump it up to 3. What the hold is doing when you're holding your breath, it's building up that nitric oxide, and then you're able to inhale it, and that again is going to help with your relaxation. You can also try alternate nostril breathing. So you're going to just plug one up, do a good inhale, and then switch and exhale. So when you're at work and you have some of the patients that we talked about tonight that you know are going to be difficult, you can work on your techniques before you see that patient. And if you're really kind, you can teach some of these techniques to that patient because they probably need it too. All right, so this is the QR code again. It's the same guide. The great thing about the guide is it's going to give you some ads about some of my favorite things that we talked about tonight. It's going to give you, the QR code is going to give you a direct link to the Fairest and the Fairest, the 6 and the 6+4, so the child and the adult one. It's going to give you some case study sheets so you can kind of think about what we talked about tonight. It's going to give you, the QR code for the intake so you can get, your free sample through there. So there's a lot of different things that you'll be able to get there. It also has all of my information. So, you can email me or you can reach out however you would like to. And that's it.
Thank you so much, Joy. That was
Yes.
amazing.
Amazing.
Awesome.
So great. I love the
Thank
breathing
you.
exercises at the end. That was awesome. So good.
Thanks, guys.
We're going to do a
Any
screen share.
questions? I don't know if you have time or if you want me to take questions or.
Yeah, we can totally do some
Yeah.
Q&A right now. Let's just
Okay.
do it.
So if anybody wants to
Unmute themselves.
unmute yourself.
I have a question.
Yes. Hi, Lori.
Hi. So I did take a myofunctional class along like a 12-week class, but I wasn't working in hygiene, so I didn't put it into action at all. And that was really hard now going back into hygiene. And I see these little things. But my one question that's no one has ever explained to me, what is a posterior tongue tie?
Okay, that's a really good question. So if you think about the blade of the tongue, right, we have a full tongue. So if you have an attachment towards the tip of your tongue, that's an anterior tie. Okay. But if you have an attachment like towards the middle of the tongue or even embedded in the tongue where you can't see it, that's like it lets the front part of the tongue move, but they can't lift the back part of the tongue, that's a posterior tongue tie.
Thank you.
Yeah.
Any other questions?
I have a question. I mentioned it earlier, Amanda, in the chat. Yeah, maybe I know that you do this in your office. Maybe you can tell hygienists that maybe don't want to go out and have their own practice, how to incorporate these techniques into the practice to help your patients along with your busy hygiene schedule.
So that is the perfect trick there. And I'm sure Joy can chime in here too. But definitely myofunctional therapy, the therapy itself is very separate from dental hygiene. And there are, varying by state, there are definitely rules and laws around that. So definitely you want to make sure you're checking into that. You need to start, of course, by taking a course. And ultimately the goal would be to get certification like Joy had talked about. And I think I'd put the link in the chat for that if you have any more questions concerning where to get that certification and how to do that. But
I mean, I work with dental offices to do just that. Like, that's what my consulting business is for. It's for people who want to incorporate all this into their practice, but they don't know how. They don't even know how to start or how to do this or how to talk to patients or, where are we going to fit it but there's so much that we can do that we're already seeing.
Yes, absolutely.
Do you travel to other states?
I do.
Okay. I know that I have my coworkers on here. And so it's something that we have talked about. So I'll chat with them tomorrow at work. But
absolutely.
We're in
like
Arizona.
I said, you guys are already seeing all this stuff anyway.
Right. I appreciate the topic. It was a fantastic course.
Thank you.
Yeah, it was so great, Joy. I really enjoyed it.
Thank you.
Any other questions out there? No? Okay. All right. I just wanted to do a special shout out. Thank you to Guru Nanda. Guru Nanda is a brand that shares our commitment to elevating oral health through a more comprehensive patient-centered care approach. Guru Nanda is dedicated to making innovative, high-quality oral wellness products, and they're accessible for everyday use, supporting not only oral health, but overall well-being. That philosophy seamlessly aligns with the Social 630 and what we stand for here. And I loved seeing how Joy has incorporated some of their products into her treatment and her practice as well, as we have in ours. Together, we believe small intentional changes, both chairside and at home, can create meaningful, lasting impact. So this partnership allows us to continue providing accessible education while connecting you with the tools that support the kind of care we're all striving for. So without further ado, we're going to stop sharing for a second, and then I'm going to pull up the wheel for our giveaway by Guru Nanda for the Guru Nanda grab bag. So we'll pull that wheel up. All righty. So are you guys ready? We're going to spin the wheel.
Are we supposed to see the wheel?
Oh, yeah. Can you not see it? Hang on.
No.
Okay, let's try this again. Thank you, Joy. We'll just add that to like the list of our fun things for tonight. Okay.
No, we just see your logo.
We're going to do it again. All right, here we go.
There it is.
Now?
Yes.
Okay. All right. Christy Warner is our winner. Is Christy still on here? Unmute yourself if you're still on here. Christy Warner. If not, we're going to spin it again because must be present to win. Do we see in the chat? Joy, is Christy on here?
Let me look.
I did not see it.
I did not see it. So double check for us if we missed it.
I don't see her. No.
Okay.
Darn.
All right.
Let's do it one more
We're going to do it one more time. Can you see our wheel?
We can see it.
Okay, perfect.
Practice rounds. Yeah.
All right. Amy.
Oh,
Rita.
That was great.
Rita, are you on here? I feel like I saw you in the chat recently.
Yes, she was in the chat. Rita, are you still here?
I'm here. Can you hear me?
Yay!
Yay!
Okay. Must have had a glitch. It must have glitched out for us. Awesome. Congratulations. We will connect with you after, but if you want to send us an email, our email is social630@gmail.com, and then we'll connect you with Guru, and they'll be sending that out to you.
Oh, awesome.
Congrats,
thank you.
Rita.
I love their products. Thank you so much.
Yes. Thank you for being on
a great class.
Oh, it was so great. Yes. Thank you, Joy. All right. We'll start screen sharing here in just a second. As we wrap up for tonight, we have, of course, one more giveaway to announce. All right. Are we screen sharing still?
Yep.
Okay.
Awesome. Hey, it's our best in chat. Holy cow, you guys. My tallies were all over the place and there were so many people. It was amazing. But our winner tonight is Carrie Ann. Carrie Ann, are you on here?
I am.
Yay!
Congratulations.
You.
That was a real neck and neck race between Leanne and Carrie Ann there. So congratulations.
Congrats.
Leanne was going in hard too.
So we'll connect with you and send you a sweatshirt.
Thank you.
You're welcome. Thanks for being here tonight.
All right. So one more time, if we didn't show this in the beginning, we just wanted to put out a little reminder. We have our upcoming hands-on workshop. That's going to be on May 1st. It's here in the South Puget Sound area in Washington State. If you're local to our area, we still have 4 spots left as of this morning when I checked. So if you would love to come to that, scan the QR code, or you can go to our Instagram page, and we'll be putting that link up in the morning for that registration in case you couldn't find it.
And what's really cool about this night is we have the ENT that we work with coming to it and speaking on, what he's looking for and what he does and his perspective on things too. So we're really excited for this.
Yes, Joy's talk tonight, her presentation tonight, in combination with Dr. Edmonds, very synergistic, going to be really awesome to have that layered on top of the foundation that Joy gave us in the fundamentals of airway and myofunctional therapy tonight. So very exciting.
Awesome. I wish I could come. I'm sad.
I know. I wish you could come too. I think it's going to be really fun. We always have a good time. It's been a blast the last few times. So, all right. And here's just a quick little overview of our calendar. Like I was saying in the beginning of the presentation during the opening, we are like blazing through this year. This year is flying by. We only have 6 more events left for the year. So we're almost halfway through. And our next one, of course, is on May 1st. And then we take a summer break. So we won't be doing anything for the summer. We're a few months off during the summer, and then we'll hit it back in September on the 9th with our next virtual. We're going to open that registration up sometime in August. Because if we open it up too soon, we fear that people will forget, they'll register and kind of forget about it. So we'll open that back up. So just be looking on our social media. We also, if you subscribe to be on our list through Eventbrite, you'll get an email reminder about that registration as well.
I just want to say, if you guys have any questions, you can always email me. Like, reach out, just shoot me an email if you have questions.
Okay.
So, of course, here's the thing you guys have all been waiting for is your CE for the night.
Okay. So you should have both options there for you. And please, so obviously click on the link, fill out the course evaluation form. These evaluation forms help us to do better. We are learning. Of course, this is our first year of virtual, so we are getting all of the technological bugs out right here in the beginning of the year. I feel like every single course, has presented something new and different for us. So, so then fill that out, click submit, and then your CE certificate will automatically be emailed to the email that you type in there. So it should work out. Any other questions from anybody before we close it up for tonight?
Thank you guys for hosting me. This was really fun.
Oh, thank you. It was an honor to have you,
support.
Joy. Yes, you've been such an amazing friend. So Joy has a study club too as well. Joy, what's the name of your study club?
Dental Innovations Study Club.
And it is so great. She has such great speakers on there. So another way to get some CE.
Yep.
And she's really great about blasting out the emails to let you know when to register and how to sign up. It makes it really easy and super straightforward. And it has been such a mentor and a gift and a light to us as we are navigating this virtual space, because we, for quite a few years, just were doing in-person meetings. Yeah. And so we are definitely being shown the ropes by Joy here. So
you guys did awesome. You did great.
Thanks, Joy. All right, everybody doing okay with the link?
Yeah, the link worked. You're good.
Okay. All right, we'll stop sharing then, and we can close it out here. Thank you so much, everybody, for coming. And we actually probably could turn our video on. I didn't realize. We appreciate everybody being here and the support, and hope you guys have a good night.
Night, ladies.
Yes, good night.
Thanks, everyone.
Thank
Great job.
Thank you. You too, Joy. Thanks for being here.
Thanks.
Thanks, Dr. V.
You're welcome.
Glad you could hop on.